Hello everyone, welcome to the channel Soul, and today is the another video on the anatomy, the first part of the anatomy. And today we are taking the topic scapular region. So the surface landmark of the scapular region are skin, then the superficial fascia, then it contains the deep fascia, and then the deltoid muscle. It is an important muscle in a scapular region which is triangular in the shape. Then the whole muscles of the scapular region. So there are six muscles of the scapular region, and these are: number one is the deltoid, second one is the supraspinatus, third is the infraspinatus, then the teres minor, subscapularis, and the teres major. Then we will study the deltoid muscle in a detail. Then the deltoid muscle originated from the anterior border and the lateral one third of the clavicle. It get inserted on the deltoid tuberosity of the humerus. Nerve supply of the deltoid muscle is the axillary nerve, which have a root value C5, C6. The acromion part of the deltoid, it is an example of the multipinnate muscle. Remember this: the acromion part of a deltoid is an example of the multipinnate muscle. The actions of the deltoid muscle are: there are three actions mainly. The multipinnate acromion fiber are powerful abductor of the arm at the shoulder joint from the beginning to the 90 degree. The anterior fiber are flexor and medial rotator of the arm. The posterior fibers are extensor and lateral rotator of the arm. So the anterior fibers are the medial rotator of the arm, and the posterior fibers are the lateral rotator of the arm. Then the clinical anatomy of a deltoid muscle. The intramuscular injections are often given into the deltoid muscle. They should be given in the middle of the muscle to avoid an injury to the axillary nerve. Then, in a subacromion bursitis, the pressure over the deltoid below the acromion with the arm by the side causes the pain. When the arm gets abducted, pressure over the same point causes no pain because the bursa disappear under the acromion, and this is called as the Dowburn sign. Remember this sign. Then musculotendinous cuff of the shoulder or the rotator cuff. What is a rotator cuff? It is the fibrous sheath formed by the four flattened tendon of a muscles of a subscapularis, supraspinatus, infraspinatus, and the teres minor. While blending with the capsule of the shoulder joint and strengthen it. The muscles which form the cuff, that is the rotator cuff, are arises from the scapula, and they get inserted on the lesser and a greater tubercle of the humerus. Then subacromion bursa. Subacromion bursa is the largest bursa of the body. It is situated below the coracoacromion arch and the deltoid muscle. Then the axillary or the circumflex artery. It is an important nerve because it supplies the deltoid muscle. So deltoid muscle is important here. So the nerve which supplies the muscle is also the important. Then this muscle is the main abductor of the arm. Then it is the smaller terminal branch of the posterior cord of the brachial plexus. Root value is C5, C6. The course of the axillary nerve, it courses through the lower part of the axilla into the quadrangular space where it terminates by dividing into the two branches. Then the intermuscular spaces. So there are three intermuscular spaces in that region, and these are: number one is a quadrangular space. The boundaries of the quadrangular space are superiorly subscapularis in front, capsule of a shoulder joint, and the inferior border of the teres minor behind. Inferiorly, superior border of the teres major. Medially, lateral border of a long head of a tricep brachii, and laterally the surgical neck of the humerus. Content of the quadrangular space are axillary nerve, posterior circumflex humeral vessels. Then upper triangular boundaries. Upper triangular space is boundaries are the superiorly inferior border of the teres minor, laterally medial border of a long head of a tricep brachii, inferiorly superior border of a teres major muscle, and the content of the upper triangular space is circumflex scapular artery. Then lower triangular space. The boundaries of the lower triangular space are medially lateral border of the long head of a tricep brachii, laterally medial border of the humerus, superiorly lower border of the teres major, and its content are radial nerve and the profunda brachii vessel. Then we will learn about the anastomosis around the scapula. This is an important topic academic point of view. It can be asked in an exam, in a university exams. So the anastomosis around the scapula occur in a three fossa: subscapular, supraspinous, and a infraspinous, by the three arteries, and these three arteries are suprascapular artery, deep branch of a transverse cervical artery, and a circumflex scapular artery. Then the anastomosis over the acromion process. It is formed by again the three artery, and these three arteries are acromion branch of a thoracoacromion artery, acromion branch of a suprascapular artery, and acromion branch of a posterior circumflex humeral artery. So this is all about the scapular region. Here we will stop. Thank you so much for watching and listening the video carefully. If you like my work, please do not forget to subscribe the channel and also press that bell icon so you get further notifications. Also like, comment and share the video more and more. Thank you so much.